So this expiration is the result of what's called elasticity. So as these muscles basically just kind of go back to where they were, the pressure in the thoracic cavity increases, and that naturally forces air back outside of the lungs. And that's called exhalation or expiration. Now, forced expiration is a little different. Like when you're blowing out candles at a birthday party, that kind of thing, when you force air out of the lungs, that's accomplished by contracting the intercostal muscles, the internal intercostal muscles. And so we want to make that volume in the cavity even smaller. And so we use our abdominal muscles, our internal intercostals, to force air out. Okay, that's forced expiration. Okay. When we talk about pressure in the thoracic cavity, this is super important. So, here in this pleural space between the visceral pleura and the parietal pleura, you have this intrapleural pressure that we want to remain negative. So, basically, that means that these membranes are sucking towards each other or pulling on each other. We call that negative pressure. That is what's going to cause respiration to be normal as far as like the expanding of this lung, the contracting of this lung. If this visceral membrane pulls away from that, then we have what's called a collapsed lung. So we want this sucking of the two membranes. We want the suction to be intact, okay? And so if we ever don't have that, then you can't bring air into the lung normally because it pulls away from all those membranes. Okay, so here where we have this has happened in this diagram, you see that the visceral pleura has pulled away from the parietal pleura. We have a collapsed lung here. So we have air here in this pleural space where there should only be this fluid that you see over here. You actually don't even see it, but it's there. But here we have air where only fluid should be between these two membranes that should be close together. We call that a pneumothorax when we have that air in the pleural space, okay? And we have a collapsed lung. So we've got to get that out of there and reinflate that lung so that we can go back to normal bringing of air into the lung, gas exchange happening, all that good stuff that's dependent on these lungs being completely filling this cavity where they belong, or completely expanded lungs. So what we use is chest tubes to suction that air out to bring that lung back over here so the visceral and parietal membranes can recouple. Okay. And we talked about, I'm sure you've seen medical shows on, how this can be accomplished. I wouldn't recommend doing that really and truly. We've seen it in a lot of shows, and I know that people have actually done it in real life and it works, but it's a bit risky. But you see that this tube has had to be inserted between the ribs right here through the intercostal muscle wall. So that can be tricky. Let's see, what other things have we talked about in the Cornell note questions? If you have trouble with the idea of pressure and volume, just think about the differences as far as like a box. If I make a box volume smaller, then the pressure inside of that box is going to increase. Okay. If I make, let's go back here so we can just kind of see this in this other diagram because it's a good one. Let's see. If I make this box smaller, okay, then I increase the pressure. And you can see that here, an increase in pressure because of the decrease in volume. So that's going to send air naturally out, okay. If I make this volume larger, okay, see the volume has now increased. The pressure has this inverse relationship with it, and the pressure in this cavity goes down. That's going to bring air in. Okay. Now, it's interesting that people talk a lot about when you go up to higher elevations that the air is thinner, maybe not enough oxygen in it for you to breathe. That's not exactly what's happening. What's happening is that what pushes this air into the lungs is what's called atmospheric pressure. And what happens is that the pressure that is on air at the sea level area where you live, that amount of pressure is the pressure pushing air into the lungs when